All right. So um, we have an annual general meeting at various locations worldwide: Australia, India, Hong Kong, Singapore, Dubai, USA, London. Every second year we have in India and exotic places like Goa and all kinds of places. Okay. And the next one is in London again. We publish a beautiful world-class business magazine, Synergy Z, by Mrs. Mayor Besania from Dubai. This month, we offered a free business webinar from New York lasting 5 weeks for kids age 9 to 14 age, teaching them all the ins and outs of starting a new business. It was a wonderful seminar. The list of activities goes on and on. But before I'm sorry, I just remember something. We just started a very special program. This is WZCC India and WZO Trust Fund. Last year, started a new program, and we are offering loans up to 25 lakhs to budding entrepreneurs in India. We have loaned about 25 lakhs to 5 young Zarathushtis already. And in spite of the dreadful COVID-19 in India, I'm happy to say that they are all doing fine. In fact, one of them in Surat, who is in the storage container business, is actually expanding at this time, and we are all excited about it. Now, looking at this success in India, we have just formed a new independent 501c3 entity in partnership with Faizana. It is called Z Foundation, ZED Foundation, that is Zarathushti Entrepreneurship Development Foundation. Our target is to raise $1 million, and we'll be giving out up to 50,000 interest-free loans to be paid back over a predetermined period. Before asking for donations from the community, the trustees have already pledged 130,000 to this cause, their personal money. So whether you are a donor or an entrepreneur waiting to start your own business, please stay tuned. It's coming very, very soon. Now, sorry, if you ask me a question like why should I become a WZC member, this is the answer you got, a long answer. So please don't ask me again, otherwise it's going to be even longer. The good news is this year, we are charging only half of the regular annual membership fee. Half of $50 is just $25. So please send a check written to WZCC Houston and mail it to our treasurer, Kershaw Kambata's office address. I'm sure you'll be proud to belong to this global organization. So ladies and gentlemen, please welcome our chapter chair, Sharmin Irani. Thank you.
Thank you, Rustam. Thank you, Rustam, so much. Yes, we do encourage you to become members. WZCC. We are very proud as a Houston chapter to be a part of the larger global org, and there are lots of opportunities that the org is actually, and it's a very active organization offering a lot of good opportunities for our kids and our teens and also adults. So please do join us in the membership. Before we kick off the meeting, I just want to go through some housekeeping rules. We will, of course, you're all muted, as you know. Rustam is muted, everybody. This is a recorded session, and we will be posting the recordings on YouTube. We will send out the address as to where it is later. It's on our WZC website on YouTube there. We also have, so it's going to be muted. There is a Q&A session at the end. So please, as you're thinking of questions, start entering them in the chat window. Go ahead and type them out as we're going through the session. At the end of it, after we go through the speakers, after both the speakers talk, then we will open up to question and answers, and Jal will be moderating the question and answer session. So we look forward to getting your questions. So with this, I'm going to kick it off. You know, COVID actually has taught us a lot, believe it or not. You know, one of the key learnings is that don't take things for granted. And then we've also all of us had to adapt and adopt new operating processes and the way we just do normal things in life that we took for granted. have become a big chore, and we've got to learn to adapt and adopt to it. One of them is working from home, staying at home in extended periods of time, and social distancing being huge. So with that, even you've got now with schools opening up, you've got institutions offering both virtual learning as well as on-campus physical learning. And as parents and professionals and business owners, we've got to make all these decisions and choices as to what is the right thing for us to do and what is the less riskier option as we work through it. So with that, we thought it'll be a great time to actually bring in Dr. Bahadur Sarkari to talk about more of the mental implications of just staying at home and working from home, etc. And we will also, after that, we'll check in with Dr. Sorab, Italia, who will touch base on his learnings and also just the physical implications. So first, we'll start off with Dr. Bahadur Sarkari. Dr. Sarkari is a psychiatrist in Houston. He has been practicing for 52 years, and he does both child as well as adolescent psychiatry. So Dr. Sarkari, would like to turn it over to you at this point. And we're going to have to unmute you, actually. I think you're on mute. So I think Rustam's going to unmute you so you can.
How's that?
There you go. All right.
Okay,
we can hear
sorry
you now.
about that. Well, let me begin by thanking you all for giving me this opportunity to share some thoughts about the effect of COVID-19 on the psychiatric aspects, and then talk a little bit about COVID-19 on school. To understand the effects of COVID-19 from a psychiatric point of view, you have to understand the actual enormity of the psychiatric problems that face us in the United States of America. And to that effect, let me give you some facts and figures which are very sobering. Anxiety disorders and depression are the two most common psychiatric problems in this country. Take anxiety, for example. Anxiety disorders affect 40 million people every year in the United States. Let me repeat that. 40 million people in the United States every year. People with anxiety disorders are seeing their primary care physicians at least 5 times than somebody who does not have psychiatric disorders. Anxiety disorder patients end up being in psychiatric hospitals 6 times compared to those that do not have psychiatric problems. Now here's a sobering thought. Anxiety disorder affects 25% of children between the ages of 13 and 17. To put it differently, 1 child out of 4 suffers from an anxiety disorder between the ages of 13 and 17. So much for anxiety disorders. Let me give you some facts about depression in this country. Depression is the #1 cause of disability in this country for patients between the ages of 15 and 44. Depression affects approximately 16 million people each year in the United States, and that's a conservative figure. Here's a sobering thought. Every year in the United States, 40,000 people, between 40 and 45,000 people kill themselves every single year. Put it differently, on an average, 132 Americans kill themselves every single day. Just for the records, depression is the leading cause of suicide in this country. Let me talk to you very briefly about the effects of COVID-19 on people's mental status. Because COVID entity is such an unknown entity so far, the anxiety and fear that happens causes severe stress in everybody. We know that. Social distancing increases both the anxiety and the loneliness. Fear and worry about your own health and about the health of your loved ones causes further stress and anxiety. There's difficulty with sleep. You have sleep trouble falling asleep, you have trouble with maintaining sleep, and you have trouble with waking up in the early hours of the morning. Because of the stress from COVID-19, you find that existing physical problems like high blood pressure, migraine, backache, and so on tend to increase. COVID-related anxiety increases the underlying psychiatric problems, be it depression, be it post-traumatic stress disorder, and so on. And most important, people who already suffer from chemical dependency issues find that the stress of COVID-19 tends to make things much worse. We know who the people are who are at higher risk without laboring the point: the senior citizens, the first-line workers, people with existing anxiety and depression problems, and people who have chronic health problems. A brief word about how do we manage anxiety related from COVID-19. Responding to stress during COVID-19 depends on your background and your personality, as well as support from family, friends, and from your community. If stress becomes overwhelming, it is very important that you see a mental health professional, be it a psychiatrist, be it a psychologist, at the least, your primary care physician. Look for the signs of stress as they begin to mount up with COVID-19. One of them is your feelings of fear, sadness, anger, numbness, and so on. Changes in your appetite and your general well-being. Changes in your sleep, as mentioned earlier. Unexplained physical symptoms of headaches, backache, stomachache, and so on. And increased use of alcohol, tobacco, and other substances. Those are the early warning signs. How do you manage that? Well, the most important thing is to make sure that you get support from your friends, family, from your community. Simple exercise like deep breathing, relaxation techniques, and so on. Regular sleep and adequate diet is important. It's important to know the facts about COVID-19 from a reliable source, be it from your state, be it from your community. If not, you get very good information from the National Institute of Mental Health. Definitely continue with your treatment if you're receiving some for your psychiatric issues. Let me talk to you briefly about children and the COVID pandemic. Children react to the behaviors of adults around them. It is important that you pick up on the early signs of stress that children would face, and that depends on the age of the child. When you have a child who's in preschool or early elementary school age, those children have difficulty expressing their feelings, and one way to recognize that is there is more than usual amount of crying. You also find that the child tends to get more irritable. These are the children who previously have mastered what we call their developmental tasks. They start to regress. They revert back to thumb sucking. They revert back to bedwetting. They revert back to toilet accidents and so on. In the middle-aged school child, the main issue is one of fear and worry. And these are the children who have recognized the concept of death, and so they tend to focus on death a whole lot. And in the teenagers, the prime symptom notice is belligerence, limit testing, withdrawal, not enjoying the things they used to. There may be school refusal, and most important of all, they start to really behave in an unusual fashion. Those are the symptoms to watch for. Very briefly, managing COVID-related problems in children and children. It's important to talk to the child, make sure the child understands you're there to help them. It is important to ask relevant questions. One point about asking questions to children, it is very important to ask them open-ended questions. It's not really helpful to say to the child, don't be afraid, everything will be fine. The child says, wait a minute, I see people dying on television, you're telling me everything will be okay. It's far better to ask open-ended questions. For example, what do you think will happen when you go to school? What are your thoughts about school when you have to go back in the fall? That gives the child an opportunity to open up about his or her feelings. Listen to the children and answer questions appropriately in an age-appropriate fashion. And you say, what is age-appropriate way to ask questions? The golden rule is the younger the child, the simpler the question and the explanation. Pay attention to what children watch in the medium and hear on the medium, and make sure you do not expose them too much to the media, particularly for the younger child, and establish and maintain a daily routine. Let me now talk about school and how school affects children and their fears about going back to school. Again, it's important to start the conversation. Let the child express his or her feelings about it. Let the kids know what to expect when they go back to school. For example, you'll be wearing a mask, so will be the other children, as will be your teacher. Explain to them social distancing, about the desk and chairs being a little bit further apart. You will reassure your child, tell him it is safe and it is okay, your teacher will help you. Remind the child that school is there to help you in any shape possible. What are some of the measures school will take to help your child integrate back in the school? The school may stagger the start and close of the school day. They may stagger the meal times. They may move classes to temporary places and to outdoors if need be. And they'll hold the school in shifts to reduce class sizes. Finally, what can you as the parents do to help the school take care of your child's anxiety? One, inquire about the safety the school take measures for. Ask the school how they will refer your child who may need special attention, be it through the school counselor, and if the school counselors are overwhelmed, to get outside help. How can you, parent, support the child's school in helping the child through parent teachers associations? And finally, if need be, request the school to provide extra help to your child in the form of remedial classes and also further help as needed. I think I'll stop there for now. And once again, thank you for listening to me.
Thank you so much, Dr. Sarkari. Thank you. So as Houston is in the forefront of the war against COVID, you know, the number of cases in Texas have spiked, and Houston is definitely high up there. So with the 120% increase in cases and hospitals running out of ICU beds, we thought we'd check in with Dr. Sorab Italia. Dr. Sorab Italia has more than 21 years of experience in the medical field, and he is definitely right now in the forefront of the war against COVID via his practice as well. And we had, he had come over earlier on, I believe it was in March, I think, towards the end of March at first. And we had, this whole COVID thing had just started. He had shared his learnings at that point, but it's been a while now. So we wanted to have him over again to learn, what he has learned since then. Things have changed, new medicines have come about. So for him to share some of his learnings with us, give us guidance, and on the physical impact of COVID and how should we, just be smart about this, especially as kids go back to school, as we go back to work, and we integrate back into community. So with that, we'll be turning it over to Dr. Italia. Thank you.
Hello, everyone. Can you guys hear me, I hope?
Yes, we can hear you. Great. Thank you.
I know. So a lot of things have changed since we talked last March. And, we're still learning too. And things have changed from week to week amongst all of us on how we treat patients and what we're seeing. I think when we talked last time, there were only about 200 deaths in Texas, and now we're up to, as of yesterday, 5,800. Hospitalizations have gotten quite a bit more as well. I was just going to talk on a few topics, and then we can leave it open to questions for any other issues people have. But, again, we tell folks that controlling this isn't going to be in doctors' hands. This is going to be in the public's hands. Prevention is going to be more of the key than treatment. And the most important thing we can do right now is wearing masks, gloves, social distancing, and try not to gather in groups more than 10. And most of the folks who end up catching this are catching it from people who are eventually going to be symptomatic, but it's usually a day or two before their symptoms begin. And at that point, a lot of them aren't wearing masks when they're getting together with their families. My practice is mainly geriatrics. I get about 1 or 2 positive cases per day when people call me. The majority of my patients who are catching it from their children and grandchildren. Roughly, we say about 50% of the spread is, again, asymptomatic. We don't call asymptomatic, but more pre-symptomatic, from a day or two before they catch it. About 1 out of 20 people who catch this will end up having severe disease and may end up in the hospital. And how we're treating them is drastically different now too. The other issue that we're seeing even now that we had the same issue before is with testing. You have a lot of testing available, but you don't get a result in a timely manner. You'll get your result back anywhere from 7 to 11 days. And the few positives that I've had in my office, by the time I've called them, they've already been hospitalized 2 or 3 days before. And we're also seeing some false negatives, with the testing. There's 20% false negative. Now, once the folks are in the hospital, we're also treating differently than what we did back in March. In March, we were more easily will put somebody on a ventilator or in the ICU. We're not doing that much now. We're pushing people much longer using a BiPAP or a CPAP, what people use with a CPAP machine. We're using in those folks, and we're using high flow oxygen to try to avoid putting them on a ventilator. So the amounts that we're seeing in the ICU are actually less, or they're more sicker than they were before. But what that has done is that's caused the mortality rate in the ICU to skyrocket. Before, our mortality rates in the ICU was about 50%. Now we're more around 80%. But you have to understand, the only people we're putting now on the ventilator are the really sick. The other issues we're still following is, and once again, majority of people who have this will probably do fine. The biggest risk factor is age. When we first started seeing issues in March, April, it was typically African-American older men. Now what we're seeing is the whole gamut. We have quite a few 20-year-olds too. We have one of our 26-year-old OBGYN residents who's been in the hospital for 2 weeks now. So we're seeing the whole gamut. In the younger population, the biggest risk factor is obesity and diabetes. That's one of the common things we're seeing in the younger folks that are coming in. The other issues that we're seeing is, with immunity. We're still doing antibody testing on these people to see how long will their immunity last. And the sad thing is that most of the time we're seeing immunity lasting anywhere from 2 weeks to roughly 3 months. It's following the pattern of previous coronaviruses, the common cold coronaviruses. And if it follows this route, then it's going to be difficult to have any kind of herd effect. You need 70% involvement to get that. Treatments have changed drastically too since we last talked. Even when we last talked, Plaquenil or hydroxychloroquine, Zithromax were still kind of on their way out. Now they're definitely on their way out. Nobody's using those. Even though the media still hypes it up, nobody uses it. The main treatment is still the old treatment, oxygen. for most folks. And we try not to hospitalize anybody unless they become oxygen dependent. We're using a lot of steroids. And actually, we've used steroids since I was in training. That's one of the mainstay treatments we had for a lot of illnesses. However, we didn't use it initially because the initial Chinese data came out showing that steroids made the mortality rate higher. But we're using that now quite a bit. We're using remdesivir, I'm sure everybody's heard of from the media. That has not decreased mortality. They're still doing studies on it. The only thing remdesivir has done is lower the length of stay of hospitalization by 4 days, from 15 to 11 days. We're putting everybody on blood thinners. And this is nothing like the flu. A lot of people will compare this to the flu. The mortality rate of this is about 15 times higher than the flu. Not double, but 15 times higher. And this doesn't behave like the flu. I mean, we're seeing people get multiple blood clots. They'll block off arteries of their heart. Once they end up in the ICU, majority have multi-organ failure. They're on dialysis. And we are using convalescent plasma from other individuals, and that's been around since the 1918 flu. That has been helpful in some folks. And there's still other things we're using a lot of rheumatoid arthritis drugs now that block the inflammatory pathways. But we're still learning. This is still trial and error. I mean, you'll hear about some gout treatments that we're using too. But be careful what you read and where you get your information from, because I still get requests from patients to carry, hydroxychloroquine or all sorts of things at home. Now, for the outpatient setting, which will be, if you do catch it, the majority of you will be outpatient. Hopefully, it will not have to come to the hospital. The treatment is still just Tylenol, Advil, lots of fluids. Best way to avoid this is, just stay healthy, stay slim, exercise, wear a mask, gloves, social distancing. This will be the best long-term answer until at least a vaccine comes out. And I'm fairly optimistic, and most physicians that are in our group and that we talk to are fairly optimistic about a vaccine coming out. Typically, wherever there's money to be made, people are going to spend to do research. So right now, I think there's about 120 vaccines being studied. There's about 12 that are in phase 3 trials. We always hear about the Pfizer and Moderna vaccines. We're also concerned about those vaccines too, because one thing we don't know is how long will the immunity last for? We don't know if this will be a once-a-year vaccine or this is going to be, twice a year. We don't know. We don't know how long the antibodies will last. And also with this illness too, even though you can't detect antibodies after some time, that doesn't mean you're not still having some protection. There's different parts of the immune system that we don't have an ability to check a level for. Long-term wise, a lot of my patients who have recovered, this again is not like the flu where you bounce back from this thing. Most of my folks all of my folks who have been hospitalized with this come home with oxygen. They're not going home without oxygen. And some of them have been on oxygen for months now. Some of them will have permanent lung damage with this. For some of the younger folks, they do better. They feel, they describe it as a brain fog where they have difficulty focusing. Some will get just short of breath with exertion. Some of the ones who have been in the ICU, who have been bedbound for a few weeks, they need some aggressive physical therapy for overall deconditioning. Now, another issue that, people have brought up, is schools. Is it worthwhile opening schools or not? And from studies that we've seen so far with little children, 10 and younger, they do very well. And some studies say they don't spread the disease as well. And there was an Israeli study that said they spread it just as much as older children. And then the children from 11 on to 18, we worry about them similar to adults, but they do better as well. And part of that, we think their immune system is just not as developed. And again, it is not the virus that is causing all these issues and damage. It's your immune response. It's an overwhelming immune response to the virus. By day 7, if you test all these ICU patients, most of them are negative for the virus, even though they will be there for weeks. It's their overwhelming immune response that causes this. So going back to the school situation, you know, that's been a debate too, you know, whether to send your children back or not. I mean, we do anticipate that once kids do go physically back to school, there will be a big bump in cases, not in the kids, but in their parents and grandparents. And we may see some kids affected too, but they're more fortunate with this disease process than they are with the regular flu. Another thing that you can do that's important, especially this year, is make sure you have the flu vaccine in September or October. Last thing we want is people coming into the emergency room with similar symptoms of COVID with the flu. They're already overwhelmed as is. And there are a lot of other treatment options too. I mean, I don't know how much you would like to go into that, but if anybody's interested, they can call me separately. But if there's any other questions, we're more than happy to answer them.
Thank you, Sorab. So we encourage everybody to please write your questions out in the chat window. We're going to go through the questions over there, and Jal will be moderating questions and reading them out. And then, you know, depending on either Dr. Bahadur, Sarkari, or Sorab, if you all can answer those questions. So thank you. I see them coming in. So please keep them coming. Thank you. Jal, turning it over to you. Thank you.
Okay, sounds good. Can you all hear me?
Yep.
Yep,
Sounds
we
good.
can hear you, Jal.
Okay, so the first question on the chat is, what is your opinion of the accelerated vaccine development timeline? So you talked about that a little bit, Sorab, about the timelines and all. You mentioned how many are in testing and how many are actually in phase 3 and all. So anything to add to that?
I mean, I know there's some apprehensions about getting the vaccine. I think some of the surveys have shown that a third of the public won't get the vaccine, is what they say. But, you know, I'm a big proponent of the vaccine, especially for, you know, high-risk groups, first responders, and especially for folks over 65, and most especially for nursing home patients. That's where we're getting some of the biggest outbreaks and the biggest number of deaths.
Okay.
This is an RNA vaccine. It's not the first of its type. I mean, there are quite a few RNA vaccines in research. They're doing the same type of vaccine for cancer treatment as well, prevention. And this is how the Ebola vaccine came around.
Okay, thank you. Then the next question is, if I tested positive, do I call my doctor right away? Is there anything I can do to boost my immunity?
If you test positive, I tell people don't panic. Majority of folks are going to do fine. You know, push lots of liquids, alternate Tylenol, Motrin for any fever. You know, the time I tell them to contact me is if the coughing does not abate, if they're starting to get any shortness of breath. You know, some things that are useful at home for these folks is have a thermometer and have a pulse oximeter. Before they were difficult to get, now they're $30 at Walmart or on Amazon. Because you're checking, that's one of the things we look at and helps me the most when a patient calls me when they're not doing well.
Okay, thank you. Next question is, will they have enough flu vaccines and when will they start?
Flu vaccines are coming out. Ours will be in our clinic by next month. And we've ordered more than typical. But ideal time to get it, we say, is end of September, October. That way it tends to last longer through the season. But, you know, again, that's variable too. We've had some early flu seasons and some flu seasons in the summer. But September, October typically is the best time.
Okay, thanks. Next one, what do you think about folks wanting to go for dental, vision, etc., yearly exams? Do we put that off due to close proximity with doctors?
Well, I worry more about the dentist than the optometrist. They're wearing N95 masks. They're wearing a surgical mask on top of their N95 mask. You know, that's how I see everybody. You know, I worry about giving them something, and you know, the biggest issue is them catching something from you. But you know, with a lot of things with my patients, if it's not an emergency or an urgency, they've been putting it off.
Okay. Next question again for you, Sorab, is can you elaborate on permanent effects of or permanent effects to different organs, mainly the brain?
Well, I haven't had a patient, but you know, when you have some of these patients, the word gets around fast. We've had some encephalitis patients. We've had 2 who were comatose and subsequently passed. You get microemboli and thrombus, multiple clots form with this disease process. So you can get some permanent issues. You can get strokes. We've also had issues where people were so hypercoagulable, they had clots everywhere, and we put them on blood thinners, and they had the side effect of the blood thinner and bled into their brain too. But those are the really sick folks that we typically, you know, hate to say, but have made comfortable and sometimes let go. These are usually our much older patients.
Okay, thanks. And so there's a related question about blood thinners. It says, since blood clots can be a problem, is it advisable to take blood thinners if you test positive?
It's not recommended as an outpatient setting to do that. You know, blood thinners aren't totally benign. You have increased risk of bleeding with those as well. You know, what we do for folks is we monitor some blood tests, SED rate, inflammatory markers. The main test is a D-dimer. I don't know if that means much to anybody, but if the test is high, we'll use full dose anticoagulation. If it's, you know, within normal limits, we put everybody on what we call a DVT prophylaxis dose. That's in the hospital. But outpatient-wise, it's not recommended.
Okay. Thank you. Next question, is it a good idea to send preschool-age children ages 5, 6 to in-person classes in the fall, or is it better to stick to online classes?
You know, that's a personal decision. You know, and also to me, that decision is based upon, you know, who you have at home with you, who lives in the household. What kind of work does the parents do? I mean, all those things. You know, for me, my kids are high school kids, and I opted not to send them to school.
Okay.
But I don't think we have a choice at this point. From what I understand, I think every school is starting online for the next 6 to 8 weeks, except private schools, possibly.
Yeah. Okay. Next question is, side effects are not known for many years. How long should we wait before taking a vaccine? So I'm assuming the question is related to side effects of a vaccine.
Yeah, I'll be taking the vaccine as soon as it's available. And it depends on, you know, you look at risk versus benefit in everything you do in medicine. You know, from the way, you know, it depends on your age group. I mean, if you're a 20 or 30-year-old and you opt not to take the vaccine, you know, that's different. But again, folks who are opting not to take the vaccine are also opting to risk catching it and spreading it to somebody else who has not been vaccinated. And we don't know the efficacy of the vaccine either. You know, how effective it will be, or will it, because, you know, the flu vaccine varies year to year. And this is not going to be a one-time vaccine. This disease is going to be, it's a pandemic right now, but we expect this will become what we call endemic. This is staying with us. This isn't going away.
Okay, thank you for that. Next one is oximeter, a good indicator, how to use it.
Yeah, just put on your finger. If it's starting to stay less than 94, let your doctor know.
Okay. What do we know about permanent lung damage?
Yeah, I've seen, you know, in medical journals, I've seen autopsy pictures of people who had severe disease. But, you know, we're seeing, you know, with lung damage, there's 2 types of processes called an obstructive and a restrictive. You know, this is causing more of a restrictive type issue. Kind of like scarring. That's basically the easiest way to describe it. You know, other bad bouts of pneumonia will give you permanent lung damage too with scarring. Some of these folks, depends on their underlying conditions. If they're a smoker and have underlying COPD, you know, that will exacerbate things too. Some will end up on permanent oxygen, permanent breathing treatments, inhalers.
Okay, thanks. So the next question is, since the flu symptoms and COVID symptoms can be pretty similar, does that mean every time you have flu symptoms, you get tested for COVID?
Well, that's why we're trying to get everybody vaccinated. Because, you know, here is the problem. Even if you go get tested today, you will not typically get a result for about 8 days. What do you do for those 8 days? If you're positive and if you have symptoms, that's one thing. You should isolate. But if you have no symptoms, you know, testing is kind of questionable right now too. It would be different if we had rapid testing and you can get a result right away, which we do have that in the hospital setting.
Okay, thanks. And the next question is for you, Bahadur. It says many school districts are opting for online school for the fall semester. Concern is around kids staying at home for extended periods of time. What are some of the psychological concerns we should watch out for?
I think the most important thing to consider is when children go to school, they don't only go there for learning, but they also improve their social skills. They have to interact with other children and they learn all those tasks. Now, prolonged periods of staying at home invariably affects those social skills to some degree. And so that's something that parents need to watch out for and do everything possible to help in that area.
Okay, thank you. And again, a question for you, Dr. Sarkari. It's what is the best way to handle somebody who approaches you without a mask?
Well, again, it all boils down to how well you know that person. Your approach will be a little bit different to a complete stranger. And what I tend to do, and we've had those cases in my clinic where somehow they've slipped through the net, if you will. You have no choice but to be politely very frank and say, you know, you may not wish to wear that mask, but remember, you might be infecting others, including me. And the majority of people seem to get that message. Now and again, we've had to turn people away from the clinic, but that's few and far between.
Okay, thanks. And here's another one for you. How effective are activities such as meditation and yoga as a source of treatment for depression?
Yes, they're helpful, no question about it. Now, I'm a little bit prejudiced as a psychiatrist to say all those things do help in cases of mild to even moderate depression. But when you're looking at somebody who's severely depressed, I think those would be ancillary supportive things to do. It's very important to see a professional person who can help you with that depression, particularly when if it's very severe. But yes, yoga helps. Yes, deep breathing helps. Yes, meditation helps. But those are on top of the actual treatment that someone would receive, particularly in a severe form of depression.
Okay, thank you. And another one for you, it says, is the infection rate higher amongst psychiatric patients in your practice? How difficult are psychiatric patients to manage?
What happens is that, take for example, somebody who's been stabilized for their depression or even for their anxiety attacks over some period of time. Without any rhyme or reason, these people come back to you and say, doctor, I'm again having my sleep problems, I'm getting more depressed, I find my anxiety rates going up, I get palpitations, panic attacks, and so on. And the reason, of course, is that, as I said, not knowing a whole lot about COVID-19, people's anxiety is raised, people start to have negative thoughts, as we call it, and that in turn tends to bring back some of those symptoms. And so we have to understand that and we are prepared for that. And I've seen multiple cases. I've had people stable for years come back to me and say, Dr. Sarkari, I was doing so well on your medications are not working anymore. And I say, yes, I understand. Some reassurance, occasional change in the medication, but by and large, patients settle down again.
Okay, great, thank you. And this next question is for Dr. Italia. It says, how long do people who have had COVID stay contagious? Is there any definitive data on this? How long should one stay isolated once they have tested negative?
Well, most people, by the time they have symptoms, they've been contagious 2 days before. And they're usually contagious for about 5 days after that. So about 7 days is what they're typically contagious for. Now, the CDC guidelines say that once you test positive, from the time of that test, you should self-isolate for 10 days. It used to be 14 days, but self-isolate for 10 days. Now, retesting is not recommended by CDC guidelines. Even if I were to catch it, which a lot of physicians have, we're not recommended to retest either. There is one issue with retesting. Sometimes retesting a week out, 2 weeks out, you may still be shown to be positive. You're getting pieces of the RNA that's picking up on the PCR. That doesn't mean you're still positive. Cultures have been shown to be negative at that time, but some folks, their PCR will be positive up to 2 to 3 weeks out. But the answer is 10 days after you were diagnosed, or 10 days after the onset of symptoms. Or if there's another guideline, 3 to 5 days of being symptom-free.
Okay, thanks. So the next question is, considering that international and national studies show that children are not spreading the disease while a long period of staying cooped up is causing substantial mental harm to our young kids, should the schools consider reopening in the fall?
Well, I'm not worried about the kids per se. Kids do have issues, but even children, there's 2 studies, the under 10 years old. We had an Israeli study that showed that they did spread it more. There's a French study that showed that they did not. But the problem is not amongst the kids themselves, it's what they'll bring home. There's a chance they can bring this back home or spread it to a teacher.
Okay. Thank you. So Dr. Sarkari, this next question is for you. It says, what is the best resource to direct someone to if you get the indication that they are exhibiting some type of depression?
Most people, to begin with, tend to contact their primary care physicians. And primary care physicians are, trained to some degree to work with people who have depression. The problem comes up when depression, as you may or may not know, comes in different forms. You can have clinical depression, you can have bipolar depression, and so on. And that's where the primary care physician will end up contacting a specialist like myself with help. The first thing someone needs to do is check with their local mental health clinic, check with their primary care physicians, whatever help they can get, and then they can be referred further on to the specialist if need be.
Okay, thank you. This next question is for Dr. Italia. My daughter was diagnosed positive but not hospitalized. Can she contract the virus again?
We think so. I mean, it's still, time will tell. The key thing that we're seeing is that, there's multiple types of immune response. Antibodies are just one of them. And we're seeing that the antibodies tend to completely, or not completely go away, but are undetectable by what we can measure by anywhere from 2 weeks to 2 to 3 months. So there is a possibility to catch this again. Now, we don't know if it'll be a milder form of it. We don't know. Time will tell. It's only been here for 5 months. But we do think you can catch it again.
Thank you. Is there any new evidence regarding surface contamination protocols?
95+% we think is spread by person to person. There's not, because we don't know how much inoculation of the virus do you need to get the disease from a surface or a fomite. And the other thing we don't know is severity of disease based upon how much of the virus you're inoculated with. We don't know that either, unlike other disease processes. But again, the majority, if you want to prevent, wear a mask. They had a study that showed that if we would have worn a mask from the beginning, the death rate would have been half. And the only way you're going to control this is not through the medical profession. It's going to be the public.
Oh, that's extremely interesting statistic there. Okay, this next question's a good one also. So we're all tired of being cooped up over here, but so how safe is it to travel by airplane to visit family in another city?
I mean, I have physicians who are traveling, they're all traveling by car. But if you know, if you're going to travel, just if you have access, wear an N95 mask and wear a regular surgical mask on top of it and wear gloves.
Okay.
If you have to travel.
Okay, and a follow-up to that was, we're hearing ventilation systems are greatly improved, but can we rest assured plane travel is reasonably safe? I think you've already answered that, right?
Yeah, I would wait for a vaccine unless you have to travel. But everybody I know that's been traveling, fellow physicians have all been traveling by car.
Okay. To get a vaccine, would you recommend entering vaccine trial so that you can get the early vaccine?
I think it's too late, if I'm not mistaken. I have a partner who has lots of comorbidities. He is on the Moderna trial. So he will be getting his. He hasn't had it yet, but he's on the list. And I think his wife signed him up months ago. So you may be able to look at the two I know in the US as Moderna and Pfizer. You can probably go on the website and see if there's ability to sign up. Sometimes they even pay you to be a guinea pig.
Okay, good, good. The next question is it safe for a group of 8 or 9 friends to occasionally get together for dinner at home?
That's a personal decision. Yeah. I mean, I don't, because I have my parents to worry about and I have my patients to worry about. But you know, that's a personal choice, because all it takes is one person to pick it up from work or someplace. And the other issue is they don't have to be symptomatic. They can be pre-symptomatic. And that's how, you know, the exact number is 48 to 62% of spread is by pre-symptomatic people.
Okay, thank you. Next question is, if kids do go to school, what are some of the best practices we should follow to keep them and us safe?
I honestly don't think schools are prepared for it. Because if you look at how China is doing it, you know, America is not doing anything close to it. They have plexiglass cubicles for each desk. You know, kids, if they're going back to schools, they need to wear masks. And depending on the age of the kid, can you get them to keep a mask on? And the other issue is, how do you get teenagers to socially distance? So it'll be interesting if school starts, because the 1918 flu epidemic, the biggest surge was October. But back then, you know, schooling wasn't as important and everybody didn't go to school back in 1918.
Great, thank you. So the next question is about masks again, and it says, is it even possible for the public to get an N95 mask right now? And are the KN95s an adequate substitute?
I mean, they're adequate. Just wear either N95 you can get on Amazon now if you're willing to pay. The KN95s are available fairly regularly. You can get a painter's mask. You know, we have a lot of those. We have patients donate that to us, and we wear a surgical mask on top of it. That way you can toss the surgical mask, and we reuse N95s for a week anyway. We're not throwing them out in the hospital.
Okay. Next question again for you, Dr. Italia, is what are some of the safety guidelines that you can give college kids as they head back to college, especially living in dorms?
Yeah, it's the same things, you know, mask, social distancing. It's gonna be tough for college kids. And most college kids will do fine. It's, you know, coming back home or their professors, that's where you're gonna have issues.
Okay, thank you. Next one is, I understand that blood thinners have a risk attached to them, but how about baby aspirin?
It hasn't been proven. Baby aspirin is not a blood thinner. It's an antiplatelet. People think of it as in the same family, but it's not.
Okay, thank you. Next one is, you can sign up for becoming a vaccine trial candidate by going to clinical trials, government, and identifying which clinical trial you want to volunteer for. There are age and other limitations, so important to check your eligibility for a trial. So it seems like that's a comment someone placed in the chat about clinical trials. Okay, so that's the last question that we had. I'll turn that back over to you, Charmaine.
Okay, thank you. Well, we'd like to thank everybody for attending. And thank you very much to Dr. Bahadur Sarkari and Dr. Sorab Italia. This was definitely a very, very informative session. I think for us, especially as parents, you know, many of us on the call right now have kids going back to school, kids going to college, and you know, what otherwise would have been an exciting time is definitely concerning, and making sure we're prepared for it correctly. So thank you for, you know, answering all our questions and guiding us there. We greatly appreciate it. And thank you to everybody for attending the call. And we look forward to seeing you all again on our next session. So thank you. Have a wonderful evening.
Thank you.
We'll see you. Bye-bye.
Thank you, Dr. Sarkari and Dr. Italia. That's very
Yeah,
informative.
thank you.
For having us. Thank you.
Bye-bye.
Thank you,
Thank you.
folks.
Bye.
Good night.
Night.
Bye, everybody. Good night.
Good night.